Hi again, it's Christine. How you doing? So this video is dedicated to self-treatment maneuvers for loss of balance to your right heel. And this primarily is when your eyes are closed, your feet are together, and you're doing your self-postural testing or balance assessment once you've been diagnosed with right posterior cupulolithiasis. So I'll try to remember what I said on the other video for the left side, because it might be just this one that you do. So the modified CAT-SIB test is what you can use once you've been identified with having this chronic vertigo, to do it every single day in the morning in a corner where your feet are together and you have your eyes open for position 1, and you just notice if there's a sway. Front, back, left, right, diagonally. Have a pen and paper ready so you can start writing notes, because when you're doing this for yourself and even with someone else, it's really hard to identify what's happening if you haven't been trained enough to know what to look for. So say your eyes are open, your feet are together, you're in the corner of the room, and you're doing 30 seconds solid. Maybe a little sway here and there. Just write down what it is. Then you close your eyes, and then you're on your right heel. You're just like over there. You can't get back to the middle and stay. Some people have told me they throw themselves off their right heel because they don't want to fall that way and compensate and go the other direction. If you're compensating for another canal issue and throw yourself to your right heel not to fall, this isn't for you. You've got another one to work on. This is if you close your eyes, you're off to your right heel, then you step on the foam or a pillow or a comforter, eyes are open, feet are together, kind of doing okay. You might go to that right side, right posterior side, but you can get back to the middle usually. And then you close your eyes safely in the corner. This isn't for those who have a spinny, acute vertigo, who get up and just walk and fall. This is not for you. You need to go to the doctor, ER, your therapist. This is for primarily my patients who have gotten the vertigo diagnosis, and we've worked on treatment and identifying how to do this, who go home and say, how do I do that again? With the handouts and the reading and the pictures, it's hard on your own to go, oh, hold on, let me look at that paper. So it's a talk through for you. But you might find someone else will benefit from this, and you can share it to them. Just make sure it's, hey, if you don't know, just listen to this, because you might be able to talk to your doctor and say, hey, I might have vertigo. Can you just send me to a therapist who's specialized in this, so they can identify if I have it or not? Because there's 6 canals and 12 treatments. The things I'm doing are more for the cupulolithiasis, or the harder treatments to do, because it's chronic and you need to maintain it. It doesn't just go away. So in the other video, what I mentioned is, and I try to remember to tell everybody, most people think, oh, once I treat it once, it's done. Not usually with chronic vertigo. And most people don't look for it. Most people are identifying vertigo as, oh, I woke up and I have the spins and I have to go to the hospital. And then the doctor gave me some medicine to suppress my vestibular system. That's how they treat it. And therapists like me, we're trying to get in there and say, wait, hold on. Let's figure out what the assessment of that vertigo canal is before it's suppressed, so that they actually have more function. Because you might be somebody who stopped looking around when you're walking, or up or down, or you just got used to getting this balance problem and you think it's normal. Or people say you're older, it's normal. Well, no, it's not. It's not normal to fall down. It's just not. There's usually a reason. And if it's been chronic, it could be from a head injury, a car accident, trauma, COVID, Believe it or not, all the things we've been through in the last 5 years, traumatic, most of us. You could get the flu. You could go to the dentist, get your hair done. Some people say, well, I'm bald. That's not me. Okay, good. But a lot of people will say, no, I don't have oh, I had that fall when I was 5. Oh, yeah, that's right. I hit my head on something. I forgot about that. You just figure you're fine until you get older and your system can't manage that. And you stop doing things you love doing. You've just become used to having balance issues. You stop moving your head around. You stare at the floor. I've seen this. I've experienced it as an athlete. Same. Athletes out there, we got a lot of issues if we've had accidents and injuries, for sure. It's just we overcome it, we think, until we get older and go, what happened? Oh, it's from there in the past. So, okay, so now I've talked you through it. You can mark the video at minute 6 if you feel like you just want to skip next time. So now we're going to do the treatment for the right posterior side, and it's set up. One pillow on this side of the bed, one pillow on this side of the bed, because you're going to lie on your back side first, and then I call it over the rainbow onto the other side of the bed. I call it body movement, head stay still. So face plant on the other side. So I'm going to set a timer for you. And when I say go, you're going to turn your head 45 degrees to your left, and you're going to land on your pillow on the back behind, not your back total, but the back side of your ear. So your mastoid process, that bone behind your ear, is where you're going to land on your pillow. So it's kind of awkward. So just prepare yourself. Have your vibration tool there. You're going to be vibrating behind the mastoid when you go face plant down on the other side. And that's going to be 2 minutes. So it's 2 minutes to start. And then I'll tell you when to prompt to move over the rainbow to the other side, face plant down, 2 minutes vibration, 3 more minutes in the same position. So 2 and 7 time frame. Make sense? Okay. And eventually, maybe you can do it yourself. It takes a lot of work. Just know that. Okay. So I'm going to set the timer. Set timer 2 minutes. Turn your head to your left, 45 degrees. Lie back on your right mastoid. You're on the pillow, staring at the ceiling, just hanging out. 2 whole minutes. Don't move your head. Just stay there. Make note of any symptoms you feel. Dizziness, nothing, nausea, tingling, pain on the right side, back side of your body on the right. Some people say this is tremendously difficult at first. Just notice if it is. Are you holding your breath? Remember to breathe. I tell pretty much everyone that. Everybody's holding their breath. Remember to breathe. You want to tell your brain this is okay to do. It's okay to feel these things. They're just symptoms. Your brain is just trying to hear messages coming from the body. It's nothing to fear. We have 30 seconds. You're going to prepare yourself for how you're going to get across to the other side of the bed to face plant down, left eye in the pillow, right eye looking at the floor. Do not move the head, just the body. You got 10 seconds to slowly lower your legs. Get your vibration tool ready. 3, 2, 1. Okay, you're face down, left side, left eye into the pillow, right eye at the floor. You're vibrating behind your right mastoid for 2 minutes. Remember to breathe. Keep track of what you're feeling. This is usually where people feel the symptoms. Not always, just usually. Could be different sensations. Just make note mentally of what you feel. Fear and anxiety can be part of it. Don't discount those. I'm just looking at my timer, so I've never done this before, so I'm trying to do the video and pretend like I'm sitting with somebody with the treatment. So when this buzzer goes off, this timer, you're going to stay in this position. Don't move your head. Don't move anything. Just take the vibration off once you hear the timer. We're going to be here another 3 minutes. So in 3, 2, 1. You're just taking the vibration tool away, but you're staying here 3 more minutes. Set timer 3 minutes.
4 minutes, starting now.
It said 4. I said 3, but I'll let you know. 3 minutes. So the last 3 minutes here is basically letting the transition of the otoconia that were out in the canal get back to the house they're supposed to be living in. So this is where you might feel the most, or perhaps when you sit up, because they're moving. So whenever they're moving is when you have the most symptoms happen. Just kind of be aware. Remember to breathe. And know that if you've had this for a long time, you might not know it other than someone diagnosed it, and your symptoms have become so habitual that you've stopped doing things in your life that you enjoy or feel like it's normal to be off balance. You might have just gotten used to that, and just see if this helps. Take a breath. We've got 1 minute to go. Just notice if things are changing, reducing. Some people say nothing at all. That's okay too. If you're thinking, well, why would I do it if I have no change? You'll know when you do your balance. You'll know when you're doing your functions in life. If it's easier to do the things you've stopped doing without worrying about falling anymore or feeling dizzy, nauseous, throwing up. There's so many different things people have. Less pain. That's a big one. Less pain in the right posterior side of your body. That's been there for years sometimes. You just get used to it. So in 3, 2, 1, it's not going to go off this time because it hurt at 4. So go ahead and slowly sit up on the same side you're on. You're just lowering your legs down, bringing your trunk up, and just stare straight ahead. I'm going to do a timer for a minute. Just see if you feel any more dizziness, nausea, lightheadedness, pressure, tingling. Maybe sometimes your ears will pop or stuff, like if you're stuck with wax in your ears or like something like a pressure in there, it sometimes pops because the system's open more. So it's letting things relieve and come out instead of compressing all the time. Sometimes TMJ is settled by this. What else? Boy, there's just so many things. And I say them because some people go, oh, yeah, that's right. I had that. Okay. I forgot about that one. Just remember to write the notes down for yourself. Okay. Here's our minute. All right. So kind of take note of if anything you felt different, changes that happen, just scribble them all out because that's your body's way of telling you the right posterior cupulolithiasis needs to be treated. Again, it's not a one and done. It's a management. It's like you would do with your nutrition, with talking to your friends, with the things you love doing. And maybe you gave those up and now you can try again. So when you're ready, stand back up, go again and do your balance test for yourself. In your corner where you're safe, feet together, eyes are open. You're navigating the system again, realigning with gravity. Feet are together. Just notice if you're wobbling, can you get back to center? So I'm going right. Can I come back to center? I'm going right. Can I come back to center? And then try again, 30 seconds, 30 seconds. Try a few with your eyes open. Close your eyes. Did I go right and come back to center? Make note of that. Did it change? Did you go right, come back to center, and then go somewhere else? You could have more than one canal out, which if you've worked with me, I've written down which ones for you are your maintenance head maneuvers you need to do. So I don't know how many videos I can do today. I'm running out of time, but I will try to do maybe one more, and then maybe have to do the other 3 another time. Because we have 6 canals with cupulolithiasis, and those are the challenging ones, and those are the ones I'm doing. I might eventually do the ones that move. Those are a lot easier. And so again, if you feel this is beneficial for you, please like it with the thumbs up at the bottom of the screen, subscribe. And if you feel you can share it with someone who might go, oh, I could use this for my doctor, to ask for a referral for, I'm an occupational therapist, physical therapists typically do this. You just want someone specialized in evaluating all 6 canals. You'd need to ask, hey, are they someone who tests all 6? Because some people just do 2. And if you have 2 that aren't out, but 4 are, you'll feel like, oh, well, now what? So you want to know they do all 6. Okay, so again, thanks for coming. Seeing your friend Christine here. And I'll do one more today and then keep going. I hope you feel better and have a great day. See you next time. Bye for now.